Welcome back to the equine anatomy lectures. Uh, Again, we started on the anatomy of the head, and then we've talked about a number of features, external features on the skull, a number of bones, incisive, nasal, frontal, maxillary, lacrimal, and occipital. And we also talked about a number of external features like the facial crest, like the nasal incisive notch and the mandibular notch. And then we've talked about three foramina, the mental foramen, the mandibular foramen, and the infraorbital foramen. And then we've talked about, nerve blocks in these three foramens. Today, I will be talking about the five nerve blocks around the eye. So we've talked last time about the nerve blocks on the face. Today, we will talk about the nerve blocks of the eye. And there are five nerve blocks in the eye or around the eye: supraorbital nerve block, auriculopalpebral nerve block, lacrimal nerve block, zygomaticofacial nerve block, and infratrochlear nerve block. Um, Today, what I will do is I'll give you a little bit detailed information on these nerve blocks and the landmarks for how to get to these nerves and what do they um, anesthetize, or how can you utilize them in the clinic. So first of all, before we start that, let's talk about where do these nerves come from. And I think I had a pretty simplified way, if you will, to make you memorize them. So let's see. Here I try to simplify the way you're going to memorize the nerves. 4 out of 5 nerve blocks are coming from the trigeminal nerve. So the supraorbital, lacrimal, zygomaticofacial, and infratrochlear are all coming from the trigeminal nerve, the fifth cranial nerve. Only the auriculopalpebral is coming from the facial nerve, which is the seventh cranial nerve. Now, 3 out of the 4 that's coming from the trigeminal are coming from the ophthalmic branch of the trigeminal, and these are the supraorbital, lacrimal, and infratrochlear. Only the zygomaticofacial is coming from the zygomatic branch of the trigeminal. The auriculopalpebral is coming from the palpebral branch of the facial nerve. And next, I'm going to show you the same pictures that you've seen before, so you can have a mental image of where are these nerves coming from. Again, you have seen these two pictures earlier in the first lecture, and as you can see, you have two major nerves in the left one. The first one is the facial, and the second one, which is the trigeminal. In the second one, which is the right-hand side picture, you can see the branches of the trigeminal nerve. The trigeminal nerve gives you the mandibular nerve, the infraorbital nerve, and the mental nerve. All of these are coming from the trigeminal. Around the eye, all of them, if we go back to the left-hand side picture, all of them are coming from the trigeminal, which has the first red circle around it, around number 5, which is 5 in ruminal numbers, and this nerve is the trigeminal nerve. All of these branches around the eye, around the orbit of the eye, are coming from the trigeminal, except only one nerve, and that is the auriculopalpebral, which is coming from the palpebral branch of the facial nerve. So let's see how are these points basically located around the orbit of the eye. This picture shows where are these nerves are coming around the eye and close to the eye. So the first one, number one, is the supraorbital, and this is pretty easy because it's coming from the supraorbital foramen, and it's pretty easy to palpate on the equine skull. Number two is the auriculopalpebral. Number three is the lacrimal. Number four is the zygomatical facial, and number five is the infratrochlear. Again, supraorbital is number one, auriculopalpebral is number two, lacrimal is number three, zygomatical-facial is number four, and five is the infratrochlear. Let's look at the nerves that will be anesthetized during these nerve blocks. These are the nerves. First, the supraorbital nerve. The supraorbital nerve, number one, which comes from the trigeminal nerve and goes into the supraorbital foramen, just above the eye or the orbit. The supraorbital branch of the ophthalmic nerve, a branch of the trigeminal nerve. Also, there are portions of the auriculopalpebral nerve, which is, as I said earlier, a branch of the facial nerve. We use a three-finger method. A three-finger method between the dorsal rim of the orbit and the supraorbital fossa, and I'll show you how to do that. This nerve blocks prevents sensation to the upper eyelid. Prevents sensation to the upper eyelid. So if I have a problem in the upper eyelid, laceration, a tumor, a lesion in the upper eyelid, this nerve block is an important one to utilize. This is the three-finger method. So you use the index and the middle finger. One is at the dorsal rim of the orbit, and the second one is at the supraorbital fossa, which is the middle finger. Now, the third finger basically will fall into the supraorbital foramen. You can see in the second picture how when you palpate this foramen, you can inject your anesthesia easily at that location. The auriculopalpebral nerve block, again, it's coming from the palpebral branch of the facial nerve, located at the dorsal edge of the zygomatic arch. So we palpate the zygomatic arch, and we give the injections there. I'll show you again how it's done. This nerve block is very important because it prevents blepharospasm or blinking. So you need that all the time if you want to do an eye exam. That's a very important nerve block to prevent blinking. Let's see how it's done. This is the area where you need to palpate the zygomatic arch. The dorsal edge of it is where the palpebral branch of the facial nerve is coming from. And you can see this in the picture here that you've seen before. Again, the first circle that's coming from the trigeminal nerve, it goes to the ophthalmic and the maxillary and the mandibular. We are not concerned about the maxillary and the mandibular. We are only concerned about the zygomatic arch, and specifically the dorsal branch of the zygomatic arch, where we need to give those injections. If we look at the live horse, this is a live horse where we can see and feel the zygomatic arch before we give the injection for the auriculopalpebral nerve block. Again, this nerve block is extremely important to prevent blinking. We call that blepharospasm. And to prevent blinking, we use that in all eye examination cases. Horses are pretty peculiar about touching their eyes. When they close it, no one can open it. So what we need to do is basically do this nerve block so the horse is not going to be able to close the eyelid and or the upper eyelid again, and so will prevent the whole eye from blinking, and so we can examine the eye comfortably. Look at the picture here. This is another one that'll show you another series of pictures that shows you where basically we palpate the dorsal edge of the zygomatic arch, where we put the needle, and then how we can inject it. It's a pretty straightforward nerve block, and it's pretty straightforward uh, examination if we can do it properly, and the result can be seen very very quickly basically. Now let's see the other nerve block. So we did two nerve blocks so far: the supraorbital nerve block and then the auriculopalpebral nerve blocks. Now we're going to come to the number 3, which is the lacrimal nerve block. The lacrimal nerve block, we do it at the dorsolateral third of the orbit. The dorsolateral third of the orbit. And again, it's the lacrimal nerve branch, which is a branch of the trigeminal. Again, all of them are coming from the trigeminal, except the auriculopalpebral coming from the facial. Always remember this rule, basically. Look how we do the lacrimal nerve block at the dorsolateral third of the orbit. This is basically a pretty clear picture of where we're going to do the lacrimal nerve block. We palpate the dorsolateral third of the orbit, and we give the injection right in that spot. So third nerve block after the supraorbital, auriculopalpebral, and then lacrimal. Now we're going to do the zygomaticofacial nerve block. The fourth nerve block around the eye is the zygomaticofacial nerve block. Again, the zygomaticofacial is coming from the trigeminal, and the landmark to do this nerve block is laterally along the ventral margin of the orbit. Laterally along the ventral margin of the orbit. Let's see how it's done on the real horse. This is basically how it's done. It's done laterally on the ventral margin of the orbit. That's how you do the zygomaticofacial nerve block. Now we reach the fifth or the last nerve block around the eye, and that is the infratrochlear nerve block. The fifth and the last nerve block that's done around the eye is the infratrochlear nerve block. Infratrochlear nerve block. And the landmark to do this nerve block is medially on the dorsal orbit. Medially on the dorsal orbit. Unlike the zygomaticofacial, which is done on the ventral margin. This is done on the dorsal margin of the orbit. Dorsal margin of the orbit. Let's see how it's done on a real horse. Again, you find the trochlear notch around the orbit, and basically when you palpate that, that is where you put your needle and inject your anesthesia. So we talked so far about 5 nerve blocks. These are 5 nerve blocks again. Supraorbital is number 1. Auriculopalpebral is number 2. Lacrimal is number 3. Zygomaticofacial is number 4. Infratrochlear is number 5. 5 nerve blocks around the eye. 5 nerve blocks around the eye. Supraorbital, auriculopalpebral, lacrimal, zygomaticofacial, and infratrochlear. All of them are coming from the trigeminal nerve except the auriculopalpebral, which is coming from the facial nerve. And all of them are essential to treat or to examine the eye. The auriculopalpebral is a nerve block that is utilized to prevent blinking. This nerve block is very important to perform anytime you would like to come near the horse's eye, because if you don't, the horse will close its eye and you won't be able to either examine or look into any lesion there. So we've talked about the 3 nerve blocks on the face and the 5 nerve blocks around the eye. Now we'll move to a different topic. Still we are on the horse's skull, and that is the nasal cavity. Nasal cavity is the first special structure in the horse's skull that we will be talking about. And here, what I will be talking about is a number of points. So I'm going to be talking about some outer features, true and false nostrils in the nasolacrimal duct, and I'm going to talk about some structures in the nasal cavity, septum, concha, and meatuses. Let's take a look at first the external features of the nasal cavity. The external features of the equine nostril consist of 2 structures, a true and a false nostril. The true nostril is the one indicated by the arrow in the bottom. The upper arrow points at the false nostril. Yellow and red arrows respectively. The bottom one is yellow, the upper one is red. This is another picture that shows the real or the true nostril and the false nostril. And these features are very important. They're not trivial. The reason why is because when we do nasogastric intubation, what we need to do is we need to block the false nostril with our hand, as this clinician or tech is doing, and we pass the nasogastric tube in the true ventral nostril. So we block the false nostril and we pass the tube in the ventral or true nostril. Same thing when we do endoscopy. Very, very common procedure. We block the false nostril, which is the dorsal nostril, and we pass the endoscope in the ventral true nostril. Now we have to be very careful here because sometimes if we're not careful, we can uh, cause a severe bleeding, something like this, especially when we injure one of the concas inside the nasal cavities, and that's the ethmoid concha. Um, on the left hand side, you see normal ethmoid concha, and on the right hand side picture, which is B, you will see a case that's called ethmoid hematoma. And again, this can cause by other factors too, other than just passing a tube or passing an endoscope. But it's pretty common in cases of passing the nasogastric tube or the endoscope by inexperienced individuals. So we have to be very careful in this case. So true and false nostrils are basically two of the external features in the horse's nostrils. Another another external feature in the horse's nostril is located on the ventral aspect of the true nostril, on the floor of the true nostril, and that is the opening of the nasolacrimal duct. The nasolacrimal duct. So this duct can lead all the way from the nostrils to the medial canthus of the eye, and that's very important. Sometimes it can be blocked by polyps or by certain unwanted growths, that blocks it, and that will lead to excessive lacrimation from the eye. So we have, when you're faced with a case of excessive lacrimation, one very simple test to do is basically to pass a pretty small diameter plastic tube into this nasolacrimal duct all the way from the nostril to the eye, and make sure that this duct is open. Basically, another use for it is when we do eye exam, we inject a test, a fluorescein stain. It's called Jones test. This test is called the Jones test, and basically is to diagnose corneal ulcers. If the damaged cornea took the stain, that's a positive. If it not take the stain, that's negative. But the key is that if the stain passes all the way from the nostril to the eye, that means the nasolacrimal duct is open and it's patent, and that's a positive test, positive Jones test. If it's not, if the stain could not pass to the eye through the duct, that means it's a negative Jones test. So this test is very important and utilizes or in utilizing the opening of the nasolacrimal duct. Let's see how the corneal ulcer look like. I've shown you one of it before. Let's see how it looks now. So you've seen these pictures before when I talked about how clinically important to study the anatomy of the equine head. On the left-hand side picture, you see a normal cornea and the horse, and it's the stain, the green stain, the fluorescein stain can be seen on the lashes, eyelashes of the upper eyelid. On the picture on the right-hand side, on the other hand, you can see a patch of greenish area where the arrow is pointing at, and that's we call that an increased uptake of the stain. That cornea clearly has an ulcer on it, and that's the reason why it took the stain. Again, we have to understand how we can utilize the nasolacrimal duct opening to pass the sustain into the eye, the Jones test, basically. And here you can see a positive Jones test when the stain is coming from the opening of the nasolacrimal duct. You put it in the eye and you wait a few minutes, and then a few minutes later you will find that the stain is coming from the opening of the nasolacrimal duct. That means this is a positive test, positive Jones test. So far we've talked about three external features um, on the equine skull. We've talked about the true nostril, the false nostril, and also the opening of the nasolacrimal duct. Let's dive in a little more and see what we can find in the nasal cavities. The nasal septum. The nasal septum is the next thing that we will be finding. And here's a picture of the nasal septum lined by some dots here. And you can see that it separates the two nostrils, the right from the left, and it's hyaline cartilage basically. Sometimes we will see this in the clinic as deviation of the nasal septum, which requires breaking and a surgery to fix it basically. The septum, however, as I mentioned earlier when I said we have to remember a number of basic bones in the skull, sits in the vomer bone, in the V-shaped vomer bone. This is the V-shaped vomer bone where in the middle we can find the nasal septum located. Now, sometimes again we can see this in the clinic as being a deviated or not straight. This is a radiograph showing this the deviation, and we can also correct that surgically again by breaking it and straightening it out and wait for it to heal. So this is one of the cases that we will encounter in the nasal cavity. Now, when we take that nasal septum out, when we remove it, we will find what we call the concha. This picture shows the three different nasal conchas in the nasal cavity. We have the dorsal, which is the yellow lines. We have the ventral, which is the white lines, and we have the red one, which is the ethmoid, the one that I just talked about when I said we need to be very careful when we pass a nasogastric tube or an endoscope in the true ventral nostril, not to injure this ethmoid because it's highly vascular, and injuring that causes major bleeding. So we have to be careful. So when we take that nasal septum, that hyaline cartilage that separates between the left and the right nostrils, we will find the concha. And the conchas are three: dorsal, ventral, and a ethmoid. Now, between these conchas, we have what we call meatuses, nasal meatuses. This is a picture of the nasal meatuses. We have the dorsal, middle, and ventral. Dorsal, middle, and ventral. The dorsal nasal meatus is located between the dorsal concha and the frontal and nasal bones. This is the first line dorsally. The middle one is between the dorsal and the ventral concha. We call that the middle nasal meatus. The ventral one, which is located between the ventral concha and the floor of the nasal cavity, is called the ventral concha, or the ventral meatus. So we have three meatuses: dorsal, middle, and ventral, and we have three conchas: dorsal, ventral, and ethmoid. Now, the area between these three nasal meatuses is called the common nasal meatus. Common nasal meatus. This is a picture showing the common nasal meatus. It is a cross section in the skull showing that area between the dorsal, middle, and ventral nasal meatuses. We can, and it's lined here by a yellow line indicated by the large arrow. This area is very important because that's where we actually pass the nasogastric tube and also the endoscope ventrally in this area. So this is the common nasal meatus. Ventrally, we basically pass the endoscope or the nasal gastric tube, and we have again to be very careful because we have the ethmoid concha. Injuring the ethmoid concha, as I mentioned earlier, will cause severe bleeding. This is a picture of uh, a bleeder. You've seen it before, and that's again, sometimes you have inexperienced individuals who pass a nasogastric tube or an endoscope, and sometimes not even inexperienced people. Sometimes experienced people. Sometimes they're a little too rough on passing the tubes. That sometimes it causes them to bleed again because of the ethmoid concha. We have seen this picture before. The left-hand side picture shows a normal ethmoid concha, whereas the picture on the right, which is B, shows a picture of or an endoscopic view of an ethmoid hematoma case. Now, with this slide, we conclude the discussion on the nerve blocks around the eye, as well as the nasal cavity, both external features and internal features. And next time, I will start the discussion on the paranasal sinuses.